Hi guys, so I haven't spoken about all these conditions of parathyroid gland individually. I'd like us to just take a time just to look at what all of them together. You get to see the differences, okay? So looking at parathyroid adenoma, parathyroid hyperplasia, parathyroid cancer. On this picture, you could see the adenoma, you could see the what? Hyperplasia. So adenoma is more of like a benign growth. So it's not really cancerous. Do you understand? While hyperplasia is like increase in the number of cells. The cancer is now the malignant stuff. So we'll start with adenoma, go to hyperplasia, then go to the cancer. So pituitary adenoma are benign growths. Please be looking, just be paying attention to details, right? So causes sometimes they are just spontaneous, sometimes they could be associated with some genetic predispositions. Symptoms is what hypercalcemia because there's too much what parathyroid hormone. So now leads to what increase in the levels of what calcium in the body. Kidney stones, bone pain, fatigue, digestive issues. Treatment is just surgical removal of the parathyroid gland that is affected. Then the most common type is the primary what hyperparathyroidism. Okay. Now this is what parathyroidectomy, surgery to remove what parathyroid gland. So parathyroid hyperplasia now. So enlargement of the four parathyroid glands. So when you say it's a gland is enlarged, it's due to what? Increase in the number of cells. So it's linked to a lot of things like multiple endocrine neoplasia, or probably is secondary to chronic kidney disease or vitamin D deficiency. So symptoms is similar to that of parathyroid adenoma. So there's hypercalcemia, right? So treatment is just surgical removal of the glands that are affected. Okay. Then moving to the last one now, which is what parathyroid cancer. This one is a malignant one now, right? It has the ability to now metastasize, spread to other parts. So causes most of the times is unknown. So symptoms are severe hypercalcemia, too much calcium, significant bone pain because it's now metastasizing to the bones. Treatment is what extensive surgical removal. Possibly you remove it including the surrounding tissues, right? So these are the differences between the three conditions, right? They're quite totally different.